Bismillahirrahmanirrahim. Assalamu alaikum. My name is Kulsum Ayub. My seat number is BP 1650110. My group number is 54. The topic is corneal ulcer. Now, first we will discuss what is corneal ulcer. Corneal ulcer, also known as keratitis, it is an eye infection which is caused by bacteria or fungi or any other allergy. Basically, corneal ulcer is an open sore that forms on the cornea. It's usually caused by small injuries to the eye or erosion caused by wearing contact lenses for a long time. Here is the types of corneal ulcer. There number 1, bacterial infections, which is caused by wearing contact lenses for a long time period. Number 2, fungal infections. Fungal infections are caused by improper use of contact lenses, or high dose of steroids eye drops may lead to corneal ulcer. Now the last one is virus infection. Viral infection is caused by a virus which is herpes simplex virus, HSV, that causes cold sore, can cause corneal ulcer. Here is the symptoms of corneal ulcer. Redness of the eye, severe pain and soreness of the eye, tearing, pus, a white spot on your cornea, inflammation of the eyelid. Now, here is the case study about the corneal ulcer. I have a soap notes here, subjective, objective, assessment plan, and in the end notes. First, we will discuss subject about this case study. A 72 years old male patient presents with evaluation of corneal ulcer. The chief complaints are severe pain, redness of left eye over the past week. What is the chief complaint? Chief complaints are severe pain, redness of left eye over the past week. Then the medical history. He has a hypertension, history of herpes simplex keratitis with corneal infection, history of rheumatoid arthritis. Additional case information: he had a corneal ulcer of left eye treated a few weeks ago by another optometrist. Patient treated for allergies with prednisolone acetate 4 times a day at the extended release with no relief. Now the medications he is taken are amlodipine, aspirin, ramipril, leflunomide, tocilizumab. These are the medications he was taking. Now the objective of this case study. In the lab, we will perform a practical and the corneal culture plated on chocolate agar, blood agar and sebor agar, which shows growth of staph epidermidis indicating contamination. This is the main objective of our case study. Now the visual acuity 20/50 of right eye, 20/150 of left eye, mild periorbital edema of left eye. 20 by 150 of left eye. It is the main cause of corneal ulcer. From this visual acuity of left eye 20 by 150, it is the indicating of corneal ulcer. Now the assessment diagnosis of staph marginal keratitis usually occur as corneal infiltration near the limbus. Corneal epithelium is normally intact in this condition. Diagnosis of marginal ulcer associated with herpes simplex keratitis. The diagnosis keys are history of HSK infection in the same eye, growth of bacteria on culture. Diagnosis keys we have studied before in objective, that the history of HSK infection in the same eye, growth of bacteria on cultures. The main diagnosis is patient also has complaint of rheumatoid arthritis, which increases the risk of herpes virus infection, could be due to the dysfunction of immune system. I think this is the main diagnosis about this corneal ulcer case study. This is the main and important diagnosis. Now we have a plan here. And number 1 is the Valor Cyclovir Voltrex 250 mg orally twice a day for 10 days. This is medicine for herpes simplex virus. Now the second one is Basivans 0.6% ophthalmic suspension, 1 drop left eye every 2 hours for the stop the growth of bacteria and virus. Now the third one is prednisolone acetate, 1% ophthalmic suspension, 1 drop of left eye 2 times a day. Now in the end we have our notes here. Epithelial defects heal completely with initial treatment, with infiltrate also healing well. Slight thinning of cornea is noted. Then no changes to treatment until next follow up in 3 weeks, except Basivans is to be decreased by 4 times per day for 3 days, then discontinued. Corneal ulcer can be very serious and there is a risk of losing the eye. Here is the end of this case study about the corneal ulcer, and I hope you are very aware about the corneal ulcer of eye disorders. Thank you for hearing.